Hello, everybody. Mrs. Felicia Nelson Davis here, um, coming back to you with another update. I think I was here with you on March 2nd, and today is March 8th. Um, just to briefly give you an update on what happened to me today in the middle of working, um, I got a phone call from a lady named Sarah. She's part of the St. Jude medical team, the ones who created the birth stimulator procedure and device. And just called to see how I was doing, called to see if I had any questions about the procedure or had any questions in general. Okay. So I told her about the research that I had done, looking at some of the videos and some of the pre-ops and post-ops of people who have already had it. I know they're going to be lead wires practically hanging out of my body, and I know it's going to be sore around the initial incision devices where they put the needles and the leads, and also where they put the stimulator box in near your buttock area. So I asked her, what types of things I could use to help alleviate some of the pain because there is going to be some soreness. When that numbness goes away, there's going to be some soreness, um, and going to have different, you know, everybody's going to have different results. But I'm pretty sure the soreness is going to be there. So she told me it was okay to use ice packs if I wanted to use ice packs. So I will keep that in mind and prepare myself for that. Um, and we just talked a little bit about me, why I made the decision to do it. Um, and this is absolutely the last thing I told her that I'm gonna do. I've had like 18 other major surgeries to my body, and my body's tired. I'm just not gonna cut myself anymore. After this is gonna be it as far as trying to deal with my back pain, um, surgical wise. I'm not saying that I won't still have to probably do heating pads and massages and whatever else, from here until I leave the earth, till God calls me home. But as far as surgery, this is the absolute last thing I'm planning to do. So I told her um, I'm feeling, I was anxietized about it for a couple of weeks. I spoke with my husband and I prayed and I cried and did all those things, trying to make the decision to do it. But um, I came to the decision that if the outer 10 units works for me, even though the batteries run out, a little sooner than I'd like, because I like to use them a little longer, then absolutely, if this one stays in for a couple of years, and if I don't have to change the battery every day, and it helps, numb the signals to the pain, so I can get a little bit more relief, even if it's 45%. Is that percentage is not bothering me at all, since right now I'm getting zilch. So, to say the least, we talked a little bit. Her name was Sarah again. Like I said, and she was from one of the teams that's gonna be with assisting my pain doctors, which are Dr. Uh, McNeese and Dr. Swiber. They're absolutely a godsend to me because I'm really picky about who messes with my back. And after being connected to Duke Medical Center for so many years with Dr. Christopher Brown, I just refuse to let just anybody that didn't have a good track record and good experience touch my back. That's your lifeline. You just, have to be careful with it. But lo and behold, I after I spoke with her, I was in the middle of submitting some of my books for audio. So some of my books are going to be um, formatted for audio, so you guys could now, after probably within another week or so, you'll be able to get them on audio format. There's just particular ones, and if you follow me on Facebook and Instagram and Twitter, you will see which books I am putting. I've already got the 18 books on Kindle, and I've had some of them on Kindle since 2013 that I'm now taking off of Kindle because they weren't as successful there. So those are the ones that I'm switching over to audio. You still can get them in paperback, and I'm doing some things in the background soon to get them on the shelves when you walk into stores, so you don't have to just walk up to the counter and order them POD. But that's the backgrounds of my work day today. And in the midst of that, the message popped up from the pain center, and lo and behold, my surgery date was scheduled. Um, she told me initially that it was going to be maybe 3 weeks out from today, or even a month. Um, but because I told her I had some other medical things that I needed to get done, like I need a tooth pulled. Didn't want, to do that. And then as soon as I did it, they called me and say, well, hey, it's time to get your trial stimulator and implanted, and you can't have infections and other stuff going on medically when you get that done. So April the 7th is my day at 1:40 p.m. I will, and my birthday is on April 10th. So the next video you guys will see, I'll probably have a little, birthday cake or something, or, candles floating around my, video or whatever, because it will be a couple of days before my birthday. And actually on my birthday, I just may not, I don't know how I'll be feeling um, to video and talk to you guys, but I will get with you guys right before the procedure, and I will get with you right after to let you know how I'm feeling right after. And then I'll get home and get some rest. Actually have to travel to another city um, where my pain center is to get it done. But it is outpatient. You can leave in the same day. I think I was instructed that I can't eat 8 hours before the procedure. So I will see you guys later. I'm a little exhausted. I'm getting ready to, it's time for some evening meds. I need to eat a little bit of nutrition. Getting ready to have a little bit of some broccoli and some good stuff. So I'll see you guys later. Take care. And like I said, under any of my videos, if you have any questions and you're considering this surgery, um, please text me, please email me, and I'll make sure that I get back with you, okay? And also, if you just want to let me know how you're doing, if you've already had it, and it's maybe months or even a couple of years out now, let me know how you're doing. I'd love to hear it, okay? Thanks for listening, and thanks for keeping up with my journey to the birth stimulator surgery. I appreciate your time, and send many, many blessings and prayers up for me, okay? And I will do the same for you. Bye. Much love.